The human skull is one of the body's most complex bony structures composed of various cranial and facial bones. In this video, I will be talking about the maxillary bones. The maxillary bones form the upper jaw and the central part of the facial skeleton. Together, they are considered the keystone bones of the face because they articulate with all other facial bones except the mandible, the lower jaw. Although it feels like one bone, the maxillary bones actually consist of two bones that come together and are fused in the middle. The maxilla forms the medial and part of the lower portion of the orbit, the anterior portion of the nasal septum, and a portion of the inferior orbital fissure. The maxilla forms the bottom border of the inferior orbital fissure at the base of the orbit. This fissure allows the transmission of several blood vessels and nerves, including the maxillary nerve, which is a branch of cranial nerve 5. The continuation of the maxillary nerve after it travels through the infraorbital canal is frequently called the infraorbital nerve. This infraorbital nerve continues anteriorly to the face through this hole called the infraorbital foramen. The frontal processes of the maxillary bones extend superiorly to reach the frontal bone right here and also articulate with the nasal bone to form the inferior portion of the nasal septum. It articulates with the lacrimal bone here sitting in the inferior medial portion of the orbit. As I follow the maxillary bones out laterally on either side, the zygomatic process helps form the zygomatic arches as it articulates with the zygomatic bone on either side of the face. The maxillary bones lie just lateral to the nasal cavity and contain the maxillary sinuses. The maxillary sinus is the largest of the paranasal sinuses, occupying the space between the orbit down to the roots of the maxillary teeth. If there is not enough bone height for a dental implant, a specialist will push the sinus upward or lift it, and bone graft is added to create additional space for a more secure implant. This process is called the sinus lift. Like the mandible, the maxillary bones have an alveolar margin, which is the edge of the bone. The individual protrusions between the teeth from the alveolar margin are known as the alveolar processes. The individual tooth sockets in which the teeth sit are known as alveoli. They house 16 teeth in the human adult: anterior incisors, lateral incisors, cuspids, bicuspids, and 3 molars on each side, the last of which is commonly known as the wisdom teeth. Palatine processes project medially from the alveolar margins meeting at the intermaxillary suture to form the anterior region of the hard palate. This is also known as the bony roof of the mouth. Cleft palate is a condition in which the two processes that normally come together to form the hard palate are not completely joined. This occurs in about 1 in 700 live births worldwide, but can be successfully treated with surgery. It is best to undergo treatment soon after birth or in early childhood. Other problems that may occur regarding the maxillary bones are malocclusion and open bites that may be attributed to thumb sucking. Malocclusion occurs when the top and bottom dental arches do not form a snug fit due to misalignment of teeth. Open bite occurs when the anterior teeth of both dental arches don't meet when the jaw is closed, resulting in a space between them. Thumb sucking may seem cute in young children and is not considered a big issue until a child's permanent teeth begin to replace their primary teeth. At this point, if the thumb sucking becomes an aggressive behavior, it may begin to affect the shape of the palate or how the teeth line up. This is because the placement of a thumb inside the mouth alters the normal position of other structures, including the tongue, lips, teeth, and jaw, by taking up the space where these structures are usually located. As this habit continues with time, malocclusion and open bites may occur. Both cases can, in turn, lead to chewing, eating, and swallowing problems. Incisive foramen, this hole, is located in the incisive fossa, this depression, right behind the central incisors, and is appropriately named. Blood vessels and nerves pass through this foramen. The nasopalatine nerve runs through this foramen and innervates the palatal tissues of the 6 anterior teeth. Dentists will sometimes inject anesthesia here to anesthetize the 6 anterior teeth. However, this technique is painful and is not used routinely.